Welcome into this week's Living Better with TriHealth segment. I'm Marissa Contepelli, joined by Dr. Andrew Ringer, whose focus is on the treatment and prevention of strokes. And doctor, can you tell us how someone can reduce their risk of getting a stroke?
Sure, there are a lot of risk factors that can influence the likelihood of having a stroke. Some of them are things you can't do anything about, like your family history and your age, but we like to focus on the ones that you really can influence. So if you break it down into categories, really there are 4 lifestyle choices that might influence your risk of stroke, 3 disease states or conditions, and then 2 specific disease categories that might influence that risk. So if you look at those lifestyle choices, they would include things like having a healthy lifestyle, such as including regular exercise. You want to make sure that you're active, that you're doing at least 30 minutes of physical activity every day, ideally, or at least 5 times a week. You want to make sure that you don't smoke. If you're smoking, it's really important to quit. That's probably one of the most damaging things you can do for your body, and it's one of the most influential risk factors for stroke as well. You also want to make sure that if you're overweight, you try to lose weight and try to maintain an ideal body weight. Even just losing 5 or 10 pounds can significantly reduce your risk of stroke. And then finally, being careful about what you eat. The heart-healthy diet that we hear so much about, that's really focused on eating lots of fruits and vegetables and avoiding processed foods, high sugar foods, and red meats, that's a very good way to help reduce your risk of stroke.
Now, what should I do if I recognize any of those symptoms in a loved one?
So if you're looking for symptoms of stroke in a loved one, we like to teach people about the abbreviation FAST. That stands for face, arm, speech, and time. Look at your loved one's face. If it looks asymmetric, like one side is drooping compared to the other, that might be a sign of stroke. Ask them to put their arms out in front of them, and if one of them drops and they can't hold it up, that might be another sign. And then listen to their speech. Is it really slurred like a drunken sailor, or does it just not make any sense, like they're speaking Greek and you don't speak Greek? Then if any of those things are present, then it's time to call 911. Because the faster you can get your loved one to us, the more likely we are to be able to treat that stroke.
Well, Dr. Ringer, we appreciate your time and insight. And if you would like more information, you can visit bengals.com/TriHealth.